Hey everybody, thanks for coming back. Thanks for watching those videos. What I'd like to do right now is get you guys a little bit informed on how to and why you should re-educate your patients on how to have a more functional gait, how to get your patients walking more functionally after they've had some type of ankle injury. Now, what we've typically seen in our patients and in ourselves also, that when we've had an ankle injury where we're dealing with some pain and protective mechanisms, some guarding mechanisms in through the lower extremity, is that we no longer walk in a straight pattern. We actually externally rotate the foot in order to avoid those painful positions, those painful patterns, those painful tissues. And what happens is that you start impacting more on the medial side of the calcaneus. It starts having an effect on the medial collateral ligament, the medial meniscus of the knee, the muscles that insert into the pes anterior insertion. You start externally rotating your pelvis, so there's some tightening into the glutes and the external rotators, and it just follows further up the chain. So it's really, really important that we get our patients walking more in a straight line and more functional. Now, as a reminder, there are 4 stages that we go through with gait. There is a heel strike that happens. There's a foot flat where they're sort of in a plantar flexion. There is a mid stance where the tib and the fib are directly over top of the talus and the calcaneus. And then we get to the propulsion section where it's a toe off and the toes are then propelling you forwards. So once again, we've got heel strike, foot flat, mid stance, and then toe off in order to propel you forwards. So let's have a look at someone actually walking on a treadmill. This is a patient of ours in our office walking on our treadmill, and as you can see, she's going through the 4 stages. She's got a heel strike, a foot flat, a mid stance, and a toe off. Now, with patients who are in pain, they're going to be missing at least 1 or 2 of those. So it's very important to retrain that nervous system in order to walk forwards. We retrain it by going backwards. As you can see here, she's going through the toe off portion, and then we're at the mid stance portion where the tib and the fib are directly over top of the talus. Here is the foot flat, and then she's going to have a nice heel strike. So again, we'll look at this. There's the toe off portion. Next up is the mid stance portion. The tib and fib are over top of the talus calcaneus. There's the foot flat. And also there is the heel off. So again, when you're teaching your patients to walk backwards, they really have to do it really slowly. You have to be very picky about having them do a proper toe off, walking back slowly into the mid stance, getting them into the foot flat portion, and then when they go into the heel strike, they really do have to, contract and get those toes to the nose as much as they can, because that's basically what happens when you're walking forwards. So we know how to get our patients walking forwards. You have to be very picky about being very specific and very precise about how they're going to walk in reverse. So I hope that serves you guys. I hope that you can incorporate that into your practice. If you're not already incorporating that into your practice, it's fantastic to watch your patients light up and see the nervous system trying to figure out how to walk backwards and how to walk forwards again. It's a fantastic technique that I hope you guys utilize, and I hope you enjoyed watching the video. Thanks, guys.